When we say Alzheimer's disease, it is an irreversible, progressive brain disorder. It's a degenerative brain disorder that slowly destroys parts of the brain responsible for memory, thinking skills, so that eventually they would have the difficulty in remembering things. So that's Alzheimer's disease. Alzheimer's disease, when we say Alzheimer's disease, it's the most common cause of dementia. Dementia in general, it's this umbrella term for diseases that causes cognitive loss, meaning a decline in memory, a decline in decision making or in language, accompanied by a decline as well in their activities of daily living, meaning patients with dementia would have to have help, or they become more dependent on other people in terms of doing their daily activities such as driving, shopping, managing finances, organizing their medications. So once they start to become dependent on other people in terms of those tasks, plus accompanied by memory loss, changes in mood, difficulty in making decisions, and poor judgment, that in general is considered as dementia. Now, Alzheimer's disease is the most common cause of dementia. So, Alzheimer's disease is just one of the causes of dementia, but it is the most common, accounting for about 60 to 80% of all dementia. And when we say Alzheimer's disease, it is an irreversible, progressive brain disorder. It's a degenerative brain disorder that slowly destroys parts of the brain responsible for memory, thinking skills, so that eventually they would have the difficulty in remembering things. So that's Alzheimer's disease. The early warning signs of Alzheimer's disease, number one would be memory loss. Patients would initially start with becoming more forgetful of recent events, repeating themselves, repeating questions that they just recently asked. So that's the number one warning sign of Alzheimer's disease, memory loss. Now, other warning signs would include difficulty in performing familiar tasks that they were so used to do before. Problems with language, they would have difficulty in finding words that they would want to say. Disorientation to time and place, they sometimes wouldn't know what time it is, what day it is, and even the month. They also would get confused in terms of like keeping tracks of things. They forget about bills, paying finances, misplacing things as well, thinking that they lost a certain thing, but then being reminded that they just kept that thing. So the other warning signs would have difficulty in judgment. They would have poor or decreased judgment, withdrawal from work or even from social activities. And the other warning sign would be changes in mood and behavior. So those are some of the warning signs of Alzheimer's disease. When we say memory loss or Alzheimer's disease, it's a continuum. So it's not necessarily from a normal aging, you would automatically get Alzheimer's right away. So there is such a thing as mild cognitive impairment. It is considered as pre-Alzheimer's disease. In mild cognitive impairment, you would have difficulty in remembering things, but you would other people or sometimes your workmate, your family would also notice that there has been some decline from how you were previously, that it's causing a little bit of concerns from them. Um, but you'd still be able to perform your daily tasks independently and normally. So that is mild cognitive impairment. But once you get the difficulty in performing your daily tasks, the activities of daily living, you're becoming more dependent, and it affects your daily activities. Now, that may be the early sign of you getting early Alzheimer's disease. So, when is the proper time? There really is no proper or an ideal time. But the earlier that you have those symptoms, like the earlier that you be able to screen, or the earlier that we be able to monitor your cognitive status, the better, so that we'd be able to catch whether you are on that mild cognitive impairment, so that we'd be able to prevent it from progressing to Alzheimer's disease. Sometimes Alzheimer's disease can be diagnosed clinically based on the severity of the symptoms. So as I've mentioned, it's a continuum. So once you show signs of becoming more and more forgetful of recent events, that's one particular thing about Alzheimer's disease. It affects recent memory first rather than the long-term memory. So short-term memory is what's affected in Alzheimer's disease. That's why people with early Alzheimer's disease, they tend to keep on repeating themselves what they've asked earlier. They would repeatedly ask about that thing, or they would easily forget what they did a day prior. So it is the recent or short-term memory that's initially affected in Alzheimer's disease. Now, what's more interesting is that towards the moderate to severe stage of Alzheimer's disease, it now also affects the behavior. So there would be behavioral symptoms. Patients with Alzheimer's disease would become more agitated. They would sometimes develop hallucinations. They easily get they become paranoid. They some of them would even have sleep disturbance, that because of their paranoia or the delusions, they tend not to sleep at night. So that those behavioral changes can also be a symptom that the Alzheimer's disease is progressing towards the moderate to moderate severe stages. The medications that's available at the moment, the goal or the aim of those medications would be to slow down the rapidity of the progression of the symptoms. But other than those types of medications, we also would want patients with Alzheimer's disease get more involved in terms of like physical exercises. Those activity are one way to help management of Alzheimer's disease, the non-pharmacologic intervention. Since we do not have a cure for Alzheimer's disease at the moment, our goal would really be to slow down the progression, or even to stop the progression, with the help of pharmacologic, meaning the medications that I've mentioned earlier, as well as non-pharmacologic activities. Now, these activities would include like physical exercise, mental exercises, and even we would advise patients to have more social interaction. There are numerous modifiable. So hypertension, diabetes, high cholesterol, even educational attainment is one of the risk factors of an individual developing dementia in general, or Alzheimer's disease. So that is why we are really pushing individuals to have more, like they should continue to learn new things, acquire new things to know while they are still young, to lessen or to lower the risk of developing Alzheimer's disease, because a low educational attainment is one of the risk factors. Other modifiable risk factors are head trauma, hearing impairment. So having decrease in hearing or having hearing loss is a risk factor of somebody who would maybe eventually have Alzheimer's disease. Um, social in a social isolation is also one of a risk factor. Depression is a risk factor that is a modifiable risk factor. So we have to do things to prevent or address all these modifiable risk factors to prevent developing Alzheimer's disease.